Thank you very much for having us, Bridget and Kimberly. We're certainly honored to be here and provide the results of the work that we've done and discuss any questions that you have. First, I'll start off with a little introduction of myself. I'm Jim Michels. I'm the Assistant Director for International Affairs and Trade at GAO. I'm responsible for the global health portfolio of the agency. Most of you probably know, but GAO is a legislative agency. We provide oversight for the U.S. Congress. Vast majority of the work that we do is in direct response to congressional requests from committees, inquiries from majority and minority. We get a wide variety. We do a small amount of work on our own initiation. Usually it's work that's very, very broad, that there's so many parties interested that we do it upon our own initiation. This is one where we've had a lot. The PEPFAR is an area where we've had a lot of interest from Capitol Hill. We've done 12 reports in the last 10 years. We started in 2004, 12 reports on PEPFAR, covering soup to nuts on PEPFAR implementation, planning, reporting, you name it. 4 reports on the Global Fund. Five of the 12 reports that we've done, we just did in the last 2 years. So we feel, I think the Congress feels, and we felt that this was the time to really focus some resources and energy on what lessons we've learned from the 10 years of PEPFAR, and how we can make the program even better and reach more people, save more lives. Excuse me. So, Kimberly, as you mentioned, we have a long-standing relationship. It's an independent one, but it's one where we've used each other as sounding boards, and we've tried to collaborate in the presentation of our results in order to get the best results from the work that we've done. And I think that the history has shown that the Congress has taken our work together as very informative, and has helped move the ball down the field in various ways and helped form legislation for PEPFAR. The 2008 Leadership Act had some requirements for GAO written into it, dealing with planning, program monitoring, and evaluation, which Todd Anderson is going to describe the work we've done on that work. In addition, about 2 years ago, we received a very broad request from members of the Senate Health, Education, Labor, and Pensions Committee to look at a wide variety of issues dealing with treatment. We tried to get them to focus their interest. They had about 50 questions. We tried to get them to focus their interest, but their interest was so deep and so integral to the potential reauthorization process. We thought it was important that we agreed it was important for us to try to cover as many of their questions as possible. So we actually did 3 different reports dealing with treatment under PEPFAR. And we just issued the last one last month, the last of the 3, and we're about to issue a capping report that will draw as you can imagine, 3 reports, there's a lot of detail to go in there, and so we want to pull those together in a capping report that should be out next month. So just to discuss a little bit about how we do our work. Our sources of information involve the country operational plans, annual performance reports. A big piece of all of this work here has been the evaluations that have been done, internal, external, of the program. We really beat the bushes into the country offices to provide us anything they thought was an evaluation of any aspect of the program. We have scrutinized that, and Todd again is going to talk about the results of that review. We interview PEPFAR officials, recipients, partner implementing agency. We've traveled to 3 countries on this set of reviews. We went to South Africa, Uganda, and Kenya. Spent a week in each country, and we try to get down to where it happens as much as possible. So I think that really informed a lot of our work as well. So what did we come up with? What did we find? I think there's some basic points that my team is going to elaborate a little bit for each report. Is that what we found as far as evaluation goes, we found that the PEPFAR program that they have a real commitment to evaluating performance. We found just a treasure trove of internal evaluations of the program, some better than others, obviously, but that really had a lot to say about the program. There's a lot of learning going on, and that was very encouraging as an evaluating agency as GAO is. We also found that The program has really focused on keeping costs down, cutting costs. They've focused on expanding treatment, improving retention, improving the quality of treatment. We found that the program is really focused on helping countries strengthen their supply chains so that stockouts and waste is minimized as much as possible. They've really taken a lot of steps to work collaboratively with the Global Fund, with the country programs internationally to make procurement of ARV drugs as efficient, getting it more and more efficient. So we were very encouraged by all that. Having said all that, there's always room for improvement, and that's what we're in the business of, finding ways to help government programs improve their effectiveness, efficiency, accountability. And if there's one overall thing that we would say in our report coming out next month, is going to say that better information management can go a long way to helping continue these trends, continue to get the costs down, to find the most cost-effective approaches for treatment, to compare and contrast, to find best practices, to normalize some of the treatment practices to keep costs down. That there are ways with better data management where we can improve treatment outcomes. The more that we know about how treatment is being treatment programs are being implemented and what results are coming out, the better planning can be done in the future to expand the program. And finally, supply chains. We think that the program has done a lot to keep costs down, to prevent stockouts. We think there could be more could be done with better inventory controls and better information about what the consumption of drugs are, so that just better planning for procurement can be done, and again that we can keep waste to a minimum, and we can serve more people. So we have a set of recommendations. My team in turn is going to present more detail about these findings. I think we all think that we've come up with a set of recommendations that can help improve the management of information, to expand the program, and improve the quality of treatment that patients receive. So I would happy to take any questions. I feel like I don't have much to say. My staff are the experts here, but if you have any questions about our methodology or our scope or our authority, I'm happy to entertain questions about that. In that case, then I'll turn it over to Todd. Todd's going to talk about the first set of reports that we've done. One thing I also want to mention that not only do I have my key analysts here at the table, and this first front row, I have the other analysts who helped out. A very critical component of the work we do is have multidisciplinary teams. We've got two experts from our research and methodology department, and they helped us quite a bit make sure that our analysis was as rigorous as possible, that we could stand by the results that we report. So they're here to help answer questions as well. All right.